Hello there, I'm Laura. We thought you might enjoy watching the process of the keyhole spay. We are currently the only vets in Macclesfield to offer this innovative procedure. So here's our patient and we're just inducing anaesthetic. She is then prepared for surgery. The hair is removed and it goes higher up the sides than the normal spay would have. We then place some local anaesthetic into the sites we're going to put the instrument ports. Stab into the abdomen with a special needle. And then we use a machine that inflates the abdomen with carbon dioxide and carefully monitors the pressure inside the abdomen to make sure she doesn't get over distended. We place a port especially for the camera so we can see what we're doing. We watch that going through the muscle layer into the abdomen, and then I have a little check around and make sure everything's okay, there's no trauma. The patient's then rotated on a special table so that the organs fall away from the ovary, which makes visibility a lot clearer. It's much easier to see than a normal spay. We then find the ovary and pin it against the abdominal wall with a special hook. There it is. And then I use a clever instrument which cauterizes and coagulates the blood vessels and then cuts through the tissue, and we do that all the way around the ovary. This means there is less risk of bleeding from a slipped knot from a ligature. We grasp the ovary, unpin it from the abdominal wall, and then we remove it from that instrument port. There it comes. So the same is repeated on the other side. We remove both ovaries and then we check the abdomen carefully, remove the carbon dioxide and then put sutures in the two little sites to make sure everything's closed. We use dissolvable sutures, intradermals, so there's no stitches to remove. And then this is Ellie and she's a couple of days recovering, showing off her belly, and then she's back running around as usual. So the benefits of having a keyhole spay is that it's much less painful. It's a much sooner recovery, so they're back to normal exercise, usually a week after rather than 10 to 14 days, although they want to get back to work a lot quicker. And there's less risk of wound trauma, so because the wounds are small and less painful, the animals tend to bother them less, they don't tend to get infected. If you have any questions or would like to know more about laparoscopic spays, please give us a call on 01625 501 500.